Good morning, this is Dr. Doug Willen, March 20th, and I'm broadcasting this from my apartment in Brooklyn. And this is my second day of doing a vlog. I'm a healthcare provider, I'm a chiropractor, I also am a clinical nutritionist, but mostly I just wanted to share my experience, what I'm walking through, also some of the updates here in New York City, but also sometimes my perspective of working with people. For example, in about half an hour, as soon as I finish this, I'm going to post this, take a quick shower, and ride my bicycle. Here, let me show you a good picture of that. Over the Williamsburg Bridge. And there's the Williamsburg Bridge. Now, this was taken yesterday. Yesterday, I went on a bike ride with my daughter, Lily. Can you see this? This is Lily and myself yesterday. It was a little chilly, and we tooled around, but I stopped to take a picture to see if I could bring it into this software. We are, New York City's going through a lot of changes. One thing I do in the morning, and I think everybody should do this right now if you can get your hands on a thermometer. I'm going to put this in here for a minute. And there it is. I'm at 97.2 Fahrenheit. Now, you're probably looking at that going, that's running low. Yes. And that's why it's important to take your temperature, because my average is low. If you look at this little overlay I put in, for Fahrenheit, it's 97.7 to 99.5. So at 97.2, I run low. And I need to know that because I'm going to take my temperature every single morning, and by looking at a increase for Fahrenheit, if we see a 1.5 degree Fahrenheit increase, you should be suspicious. And with Celsius being the average, and you need to know your specific average, 36.5 to 37.5 for most people is going to be the span of average. But if you have a 1 degree increase in Celsius, you should be suspicious. And typically with flus or viruses, 3 days in a row of fever is a bad thing. So I'm not saying you should wait that long. I'm just saying if you know your baseline, you can do a little screening, self-screening at home. Now, New York City is debating whether to follow San Francisco and do the shelter in place. It feels like that we're doing that already because there's so few people on the street compared to what it was in the past few weeks. Mayor Bill de Blasio and Governor Cuomo are talking about this, and we've already put 25 or recommendation, but it's not enforced, to have 25% fewer people in their offices and workspace, as long as it's not, for food or healthcare related. They're saying not food with restaurants, but grocery stores. They can have full staff right now. The next few slides I got off of the New York City .gov site, and so I just want you to know my references. But if you saw my vlog post yesterday, we were at 1,871 cases in New York City, and today, in just one day here, look at the bottom stat there. I don't know if you can see that, but we're at 3615. So that's about double. That's horrible. And the day before we were half that. So I don't know if you could see this one. Let me see if I can make this a little bigger. There you go. Okay. So again, this is from the NewYorkCity.gov site, and I took a screenshot of this page. Now, unfortunately, this page is 2 days old, but we're looking at percentages anyway, and I think it's interesting. One of the things, and I just don't have a more updated, slide than this one. This is March 18th. Today's March 20th. But take a look at two things specifically. It says the age 18 to 49 in New York City has 51% of the confirmed cases. So we're all assuming it's going to just be old people or people with compromised immune systems. Look, 50 to 64, ages 50 to 64 is 23%. Over 65 is 23%. So over 50 is 46%, but 18 to 49 years old is 51%. Another interesting thing here is that men are getting it more than women, 58% to 42%, and that's in New York. And those numbers can change as more data comes in and more testing happens, but that's what we have now, and it's interesting to see. Here's one of those scary hockey stick type graphs, where the hockey stick curves up at the end, and you're seeing, in this case, new cases is in the dark red, and the pink is the total cases. So again, this is as of March 18th, but it's, well, it says it all. So let's go to the next slide. And a couple of little news items here in New York City that I wanted to stay current with, that the blood center feels that they need more blood. So if that's something you feel safe enough to give, you would Google New York Blood Center on Google and you would get your local place to be able to do that. They say they're taking all the precautions necessary to keep a sterile environment. Another piece of news that's interesting, a lot of people don't realize how many kids we have here in New York City, and we have 1 million school children in New York City. That's such a huge number. And they're trying to give out laptops. So yesterday they were starting to do that, and there was up to a 4-hour wait. Some people were able to get some laptops, some not. So that is something that is not handled yet, but in the works. Hospitals, they're running out of supplies. Mayor de Blasio called Trump the Herbert Hoover of his generation because of the way he handles the crisis. And he was just flustered and said, for some reason you continue to hesitate. So we need supplies, and so does everybody else. But I guess we're looking for a little stronger leadership there. Now, I'm taking my bicycle both ways today. Sometimes I take a city bike, one of those membership bikes that you can use just for a few hours or, 45 minutes. And then I'll take the subway home. But now I'm going to take a bicycle both ways, whether it rains or not. I'm just going to put on a raincoat and ride in the rain. MTA, our Mass Transit Association here in New York, the subways, the buses, announced 23 employees across New York and on MTA and 19 from the Long Island Railroad, which is how millions of people come in and out of Manhattan every day from Long Island or the outlying areas in Connecticut and New Jersey. But we've already, the workers, the employees, because of the accumulation of people all in one spot, are getting sick. Let's go to the next one. They're doing more testing sites, so that's good news. I don't know, we're still way behind. So they're expanding, and this is appointment only COVID-19 testing capacity, but they're at hospitals, Bellevue, Elmhurst, Harlem, Metropolitan, Kings County, Lincoln, and so on. Again, you can Google that, so I don't have to just read you the whole list. What else? Well, we've talked about 25% having 25% less people in your workplace if possible. That's kind of the pre-step before shelter in place. I think from what I hear, almost everybody's doing that already. Our first drive-through testing facility happened. It actually started yesterday in Staten Island. I don't know how that went. I didn't get any news on that. People handling our food. So Whole Foods at Columbus Circle is one of the larger Whole Foods right in the middle of the heart of Manhattan. And they already had someone test positive. They say they sent the person home to do the quarantine. But again, listen to what I'm saying. We are sending people home to what China found was within their own families is where the most rapid spreading was happening. So someone would get sick, go home, spread it to their loved ones, their parents and children and grandparents. So a little crazy. Now this one on first glance could scare you. It's not as scary once you read a little deeper, but it says prisoners could be released. So that's such a big headline. But they're only planning on releasing 40 detainees that are already in prison hospitals that are high risk of they have compromised immune systems or are critically ill, and they want to get them out. So that might happen today. And our police force, New York Police Department, has 20 new cases. So the people on the street, and this is kind of sad because there are certain people, whether they're healthcare workers or people working for the city, people that work for transit, they wake up and they have to go to work, or many of them want to try to make that happen, and be out there, knowing that they're at risk. And we don't know how bad this is going to be. I mean, are you going to just have a mild case, or could it, even be fatal? So we're all worried. So I talked about those 1 million students, and I don't have this number. So if you have the better or the more correct number, please leave it in the comment. But my business manager, my office manager, Rena, she felt the number was close to 114,000 students in New York City are homeless. They don't have homes to go to. They live in shelters when they're not in school, or they might live on the street. I don't know. But they just don't have a proper apartment or home or shelter where they're getting food. So coming to school for many kids in New York City is a place for them to get a meal. So this is horrible to say the kids can't come to school, especially for these homeless kids that have to go back to shelters that might be a little scary, where their safety could even be compromised. So on Monday, now we're here on Friday morning, but on Monday there were 200,000 meals were served to the New York City students across the city. So I think what's happening is they're allowed to stop by the school, not for education, but to get a meal and then eat and leave, and trying to give them some meals. But we're up to 200,000 meals were served yesterday from 14,000 on Monday. So we've elevated that from 14,000 meals to 200,000 meals in 4 days. So that is a good thing. I'm sure it's not enough, but it's where we are right now. I'm going to keep doing these little posts. Let me know in the comments if this is something you're interested in seeing. Please subscribe. Please hit the alert button. Please support me by leaving a comment or just saying hello. And thank you for checking this out today.